This is wiper to spinal surgery.
You can hear it.
Yeah, you can feel it too, right? Like
Yes.
click, every revolution now, it's not going it's not opening anymore.
Cannulated pedicle probe.
Just.
This one.
Yep.
Probe in there.
Back in.
And after that,
And a button at the very, very back.
you use
And if
blunt
you need, you
guide
can kind of
wire.
push it. Yeah, you push it
Blunt
together.
guide wire through the probe, right? And if the bone quality is good, Dr. Chan, you use tap through the guide wire.
If it's a really young, like let's say it's a
Yeah.
26-year-old guy, snowmobiler, and he's got granite bone,
Okay.
he'll probably want to tap. And if he wants to tap, you can use the
Yeah.
dilator first,
Dilator first.
right? And then the tap can actually go through the dilator as a tissue protector,
Okay.
right? Because this is really sharp, right? And that would go through, protect the tissue and tap.
Okay. Tap. After that, doctor will know how size the screw, and we start to get the screw.
And that's with the extensions, the castle nut driver, and the screwdriver.
And we use with the closed only.
Closed
Not
only.
open, closed only.
Yeah, and Alex knows that. He won't ask for open. He's, I showed him what it does, but just for simplicity, we don't want to add it to anything.
This is how to load cap. After that, can you show me how to?
Yeah, do you want me to do this? Yeah?
Yes, please. Okay.
So you pick up your extension, you shake it, you want to hear it nice and loose. If it's not loose, it won't go over the screw initially, okay? If you need to loosen it, or if you're unsure, if it's like, I think it's loose, I'm not sure, safe just to put the castle nut driver in, okay? And it's 4 turns, from the very bottom lock position, it's 4 turns, okay? So now I know for sure, okay? Thumb on the top,
Yeah. I want the
pick
top.
your screw, you line up the tabs with the screw heads, right? Push down. It should be equal on both sides, right?
Yeah.
So it shouldn't be on one side and on the other. Okay, so I just have a quick little look, looks good. I leave it standing in the pan. You take your castle nut driver in the unlocked position, it goes in. This is the most important part of the procedure, right here.
Right.
Okay, so you want this to be nice and snug. You want to remember that that's locked, okay? So now we have the extension locked onto the screw. Now we need a screwdriver to insert the screw. So screwdriver goes in. Okay, it spins. If it's in a ratchet position, you'll hear it start to ratchet, right? To change it away from ratchet, the white dot lines up with the trough, okay? 2-finger tight, and that's what you're holding the surgeon, handing the surgeon. You can confirm the screw length, 6x45. Okay?
Yeah.
Now if the surgeon's like, I want a 40, or you have to switch a screw in a really big hurry, I would probably just grab another extension and just start. But if you have to take it off, you just put it back into the hole it came from. And we're reversing what we originally did. So hand on the sleeve, extension. I'm gonna back out this. Okay, and now we need to loosen the extension off the screw. So this is the one part that gets everybody. You can't just back it off. You need to lock the driver. Locked. Now I can back it off. If I start to back it off before I click the lock button, it will not allow me to lock it. I have to tighten it back down,
Okay.
right, into the position. Now I can lock it and back it off.
Okay.
Okay, so basically you're gonna do 4 full turns again. And then once your 4 turns are done,
Great. Okay, cool.
okay?
Okay.
And then the button at the very back. I like to have it on my stomach because when you press the button, it's going to kick this off and it's also going to kick that out. So for me, I just usually put it on my stomach. I press the button, I got control of this, and my stomach's making sure that this doesn't hit the floor. Okay? Clear as mud?
Yeah.
Yes, good.
Does make sense.
After that, review measurement the lot.
Okay, you want to keep going? Yeah, so.
Yes, please.
No
Thank
problem. You're welcome. So hard to explain, but basically you have your two extensions here
Yes.
coming out of the patient. Okay. Your flag stick or measuring device goes in here. Okay, he's going to tell you a measurement to read. Once you have your measurement for the rod, we're going to come over here. Your rod holder, sorry, these are all together from the last one, just 1 second. Okay, so your rod, there's 2 of them. We want to get them both ready. So the rod comes out of the pan like this. The locking cap is in this white tray. It lifts up. You're going to grab one of the locking caps. You're going to put it in. You're going to just spin so that it's not falling out. The way this works, the rod will have a notch on one side. The notch has to face the green handle, okay, and comes into the hole perpendicular like that. Okay, you're gonna hold this portion with your hand. Put the handle on your stomach like this, and then a small torque driver gets spun until it clicks. So make sure it actually torques out. You can hear it when it does. Okay, now we're locked and ready to go. Okay, this is your locking cap driver. Okay, 2 pieces.
1, 2.
You leave it loose. Put it into the screw, and then when you tighten it, it'll lock into place. Okay. And as an alternative, Dr. Chan will probably want to use this setup. Okay. 2 drivers go together. Push the button with one finger. Click. Threaded post goes on to the driver towards the white handle.
Yes.
Click. Now you're going to take a cap. I don't know what I did with it. Oh, here it is.
Okay.
Sorry. You need to take a cap. You're just going to load it as usual. And then you would hand that up to Dr. Chan. And the way this works, I can try to show you here. Hold on. So the collar comes on. Black line to black line. Belt locks it into place. Okay, now it's stuck on there. You're going to hand up the cap. Dr. Chan's going to put it in by hand to start. And then once it meets resistance on the rod, you're going to hand up the double driver. Bottom handle turns first to reduce the cap into the head. And then once it's in, top handle gets turned to put the cap in. Okay? Then he's going to pull it off. And you're done.
Okay, thank you so much.
Alrighty.
So this is the picture of the
Yes,
how
it's-
we set up.
That's the back table setup there.
Back table set up is here.
Laminated version for the room.
Okay, thank you. Have a good day.